Well, the American Medical Association is trying to push tort reform to the forefront of the health care debate. The largest U.S. doctors group sent a letter on the issue to President Obama yesterday. Dr. James Rohack is the president of the AMA and also joins us here, along with Peter, in Washington. Great for you to be with us. And, the thing I want to start off with is that, when I've always heard with the AMA and in this health care reform, a big part of this is repealing, right, or permanently repealing these Medicare cuts, Medicare cuts to doctors. And you've spent a lot of money. You've lost some membership, in fact, in your organization because some of the doctors disagree with this. And yet you have hinged your support partly on this one piece of reform. Have you, am I accurate in this or not?
Well, actually not, because
Why?
when we know that comprehensive health reform has to fix a broken Medicare formula that is going to actually, March 1st, impact access not only for millions of Medicare beneficiaries, but also military families under TRICARE. But that's just one component. The other component is we have millions of Americans who don't have health insurance because they can't afford it. And the AMA has been committed to say we need to focus on what we can do to improve American health care by getting rid of the unnecessary cost in health care. Part of that's defensive medicine. Part of that is administrative waste.
But wouldn't you say, though, that the key part of this is that you do get these cuts permanently repealed?
Well, we know that permanent repeal of a broken Medicare formula will be important for the Medicare beneficiaries and our military families. Right now, Congress, since 2002, has not been willing to address the problem. And so we have said, no more, you need to fix it, and you need to fix it permanently. So yes, we've been very focused on that. But we've also been focused on the millions of Americans who are not on Medicare. And today will lose their health insurance because of unaffordable premiums. We need to have market reforms that make sense and make sure that the doctors will continue to be able to provide the care that they think is best for their patients.
The doctor fix you talked about is expensive, as we all know, even just in the short term. $250 billion is the figure that's been tossed out there. What's going to happen on March 1st? How confident are you that Congress is going to put in even a short-term fix that gets you through to October 1st?
Well, the formula is broken. What it says is that as doctors provide better care for patients, the cuts go in, and as a result of those cuts, access is impacted. So what we want to say is, Congress, you could have fixed this 5 years ago for less than $30 billion. Because of your inaction, it's now over $200 billion. Temporary fixes only grow the problem. It's time for a permanent fix.
Dr. Rohack, your organization now represents about 17% of the 800,000 doctors in this country. Membership, though, has been dwindling. Do you still represent the majority opinion of doctors here about health care reform?
Absolutely, because our policy is created through our House of Delegates. Our House of Delegates represents every state medical association, over 170 specialty societies, medical students, residents, faculty of medical students, faculty of medical schools. So our policy is created by the profession. And what we do is we try and fight for what's important to preserve that important patient-physician relationship.
Okay.
Actually, let me just jump in really quickly. Do you, at the end of the day, as the president has this summit today, do you believe that your decision to back health care reform, back this president early on, was a mistake?
No, we don't, because we know that the status quo is unacceptable. And we talked to prior presidents to say we need to fix a system. At least this president said, okay, we're going to make it a top domestic priority to fix a broken system. And as the AMA, we know that the status quo is unacceptable. And that's the reason why we're supporting a bipartisan way to deal with this, because at the end of the day, the patients that doctors care for, we don't care what party they are. We're there to help the patient.
You have to cut the costs. Okay, Dr. Rohack, thanks so much for joining us.
Thanks
Appreciate
for having
that.
me.
The president of the AMA.